There appears to be a declining turnout at the vaccination centers across Paynesville despite the availability of both the Johnson & Johnson and the AstraZeneca vaccines in the country. Back in August, when the rollout of the vaccine began, dozens of people were often seen in queues at various vaccination centers to get vaccinated. But a recent visit to some major vaccination centers found out that those getting the vaccine were mostly people preparing to travel out of the country. This is because they will need to show that they are vaccinated before leaving the country. But what is causing the low turnout? Melvin Peabody and Abigail Doe are two vaccinators in Paynesville.
At the beginning, people were turning out to take the vaccine for the J&J. But now, like we have, the county team has many teams on the field working. And yeah, we stationed at Paynesville Town Hall. We help to get people from around to come in to do the process of giving them their vaccine. But yeah, at the beginning, it was okay, but for now, it's very low. So I think all need to do is let our friends, our family come about to take a vaccine. Those who have not yet taken the vaccine, they need to come about to take the vaccine. The importance of being vaccinated is that to help reduce the risk of getting the virus. The preventive strength of the J&J is like 83 to 95% that help to build up the immune system from getting the virus. You can get it is when you get the vaccine in your system, you build your immune system out. So the way in which it will react to you, to that of a person who has not yet taken the vaccine, it will be a less case to that of a person who has not yet taken the vaccine.
Like we started first, people was very thinking all coming, taking the vaccine, but now the center already slowed down. So ready when they come. One said we give it to them. So now we get news. So now 4 vials, 6 vials. So it's good for you to take the vaccine. And when you take it, no bad effect on it. If you take it, you will be healthier. I don't care what kind of sickness you got. You can still take it there for prevention.
Despite the low turnout, some people are still showing up at some centers. At the Dubot Rural Clinic, Robert Toy was one of the 5 persons within the second shot of the AstraZeneca vaccine.
Yeah, I came to take my second dose of the vaccine. It's a precaution. It's a worldwide something. Everybody needs to take precaution. That's what the world said. What people saying, that what the government is saying, that what everybody is saying, that we should take it so that we'll be protected. And equally so, if it is so, then we need to take it. But I think it is good, it's an advantage to everybody who may take it. It's not a force, but it's an advantage. It's to your advantage when you take it. Because normally, nowadays, if you don't take the vaccine, they will not allow you to travel, first of all. And you must put yourself in risk in the future.
Mrs. Joyce Dodo, a resident of Paynesville, who was also at the vaccination center, was worried that there might be a resurgence of the virus if the vaccination process remains at snail pace.
People are not turning out as compared to before, and I hope and pray that they will turn out because this is everybody's business, and when we turn out to take the vaccine, it's going to help us to eliminate the COVID-19 from in Liberia. So in order not to have COVID-19 coming back, so we all need to put hands together, all hands on deck, and work towards the elimination of COVID-19 by taking the vaccine.
The National Public Health Institute of Liberia statistics released on October 3 showed that over 156,000 people have taken the Johnson & Johnson vaccine, while over 65,500 people have taken the AstraZeneca jab. This means more than 221,600 people have been fully vaccinated in Liberia. This is less than 5% of the country's population, which is polled at approximately 5 million. The 5% figure for Liberia falls short of the World Health Organization request for every country to have 10% of its population vaccinated by the end of September 2021. Amid a slow pace of the vaccination process, can Liberia meet this milestone, although the time frame has elapsed? This is a valid concern that needs to be addressed. Reporting for Cool 91.9 in Paynesville, my name is Siaway Miapue.